New York City is reopening after 14 months of coronavirus restrictions. The Big Apple is almost entirely back to business as usual as bars, restaurants, gyms, and churches return to full capacity. And other cities across the country are doing the same. But there is still confusion surrounding the latest mask guidance. The CDC says fully vaccinated people can forego masks in most situations. But Dr. Fauci says some people are misinterpreting those guidelines. Just over a third of the U.S. population is fully protected against the virus. The pace of vaccinations is hovering between 1.5 and 2 million daily shots. This comes as the CDC predicts infections and deaths will continue to fall over the next month. Fewer than 28,000 infections were reported Tuesday, and that's the lowest number seen since June of last year. Mola Lenghi heads off our coverage from New York City.
Tonight, New York City, once the epicenter of the coronavirus crisis, is back in business. Most stores and all houses of worship can now open at full capacity, while the city's 3.2 million vaccinated residents can officially go maskless, indoors and out.
This 100% capacity is like a lifesaver.
Tavern on the Green co-owner, Jim Cayola.
What do you see happening here in the next few weeks?
This is just one more step today. Toward that, toward bringing the tourists back and having New Yorkers back.
Masks are still mandatory on public transit and in schools, homeless shelters, nursing homes, and other healthcare settings.
Are we close to having a national model for a vaccine passport?
You're not going to have a national federal mandate for a passport.
Today's major leap toward normalcy was nearly unimaginable 14 months ago when the nation's most populous city turned into a ghost town. Now, all across America, people are throwing open the doors just in time for summer as the new CDC guidelines on mask use continue to cause confusion.
It is not a declaration of the removal of the necessity for masks under certain circumstances, particularly when you're dealing with people who are not vaccinated.
But Texas is taking a hard stand, threatening a $1,000 fine for any local official requiring a mask, including schools beginning June 4th. Teachers' unions are pushing back, saying it's too soon to go maskless when many students aren't eligible for the vaccine. And tonight, the CDC director is warning the pandemic is not over yet.
This virus has sent us too many curveballs to say that we too early to declare victory.
Dr. Fauci told us today it's likely that people who have been vaccinated will still need a booster shot 6 months to a year later. That uncertainty there, because just how long the initial vaccine protects for is still being researched, Lana.
Mola, thank you. Dr. Hlatshwayo Davis joins me now. She's an infectious disease physician at John Cochran VA Medical Center and a member of the St. Louis Board of Health. Thank you so much for being here. Dr. Fauci says people are, quote, misinterpreting the CDC's updated mask guidance. What are your biggest concerns as more states and areas reopen?
I want to make clear that I support the CDC. I think they've worked tirelessly to help us get through this pandemic, to provide timely and very specific feedback, recommendations based on data. The challenge here is that data does not always equate to public health strategies. And I think there has been, it's been difficult with the way that this was rolled out and the timing of it because there's multiple vulnerable populations that still cannot unmask. And obviously, the biggest concern that people have had is, well, people who are unvaccinated may just decide to go maskless and we won't be able to tell the difference. And this is an issue specifically for big businesses. How are they supposed to regulate this? For schools, for parents whose kids are under 12 and are not eligible for a vaccine. So while the CDC has based this on data, I do empathize with some of these groups. But all that means is that people like myself have to work hard to continue educating folks on exactly what this mask mandate means.
Well, thank you for being here to explain that specifically. Let's talk a little bit about what we are learning from this pandemic, because the head of the CDC also says that the pandemic would have been, quote, extraordinarily different if the U.S. had a more robust public health infrastructure from the get-go. Do you agree? And if so, what kinds of tools do you think would be beneficial at the start of this fight? And are we doing what we need to do in advance of a future pandemic?
I think this pandemic unearthed some of our vulnerable spots. And here, I think leading that is how it impacted marginalized populations, Black and brown communities, who very early were shown to be at higher risk of getting COVID, almost 3 times more likely to be hospitalized, up to 4 times more likely to die from COVID. We then saw, even after we increased vaccine confidence in these communities, that to this day, we're still seeing issues around access. Not everyone has a car to get there. Not everyone has working internet and a phone to be able to sign up. And despite some of the federal interventions, they haven't trickled down to the local communities to really bridge these gaps. So this is one example of some of the issues that have been unmasked. What we need in the future for better public health infrastructure. And for me, that means centering community leaders, community organizations that have already earned the trust of these communities, who have sustainable protocols for how to engage with them so that they are at the core and at the lead of these future pandemics and make sure that our most vulnerable are not left behind.
Let's talk about the international fight against the coronavirus. India's daily coronavirus death toll set a new record on Wednesday. More than 4,500 people died there. But infections have begun falling after peaking about 2 weeks ago. Can you explain what we're seeing in India and what it portends for the future?
What's happening in India is an absolute crisis. It is devastating. And it, again, lets us know that we are still so far behind when we talk about health equity, and in this specific sense, vaccine equity. The vast majorities of low-income and middle-income countries will not even see a vaccine until 2022, we're told, whereas countries like ours here in the U.S. have access to vaccines quite readily. We need to understand how global our society is and that a threat anywhere is a threat to us all. And so what is happening in India has made it clear that we need to have better global ability to support all countries so that all of us can get through this pandemic. This requires not only support by way of finance, but also resources that will provide sustainable measures for testing, for treatment, and certainly for vaccine development that these countries can take ownership from.
And sticking with the theme of our global interconnectedness, the European Union will soon ease travel restrictions for foreigners who are fully vaccinated. And as we're starting to look towards travel abroad, different countries actually have approved different vaccines. How might this impact global travel?
You know, I think what we're beginning to see is the beginning of our new normal, right? We've been talking about, well, what's it going to look like once we start to get to that? And this is what the new normal will look like. As more and more people get vaccinated, as more and more countries and jurisdictions reach herd immunity, we will start to enjoy some of our old pleasures, travel being amongst them. And I do believe that vaccinated folks will start to see more flexibility around here. Let's be honest, we've been cooped up for a year, and folks want to get out, want to be able to have these experiences. So again, with the right infrastructure, with the right policy, but most importantly, with enough people vaccinated, this is absolutely appropriate if done right. However, if rushed before we are ready to have the types of public health infrastructure to support international travel, and if we're not at herd immunity, this will only serve as a source of greater transmission and slow our ability to get to a healthy new normal for everyone.
All right, Dr. Hlatshwayo Davis, thank you so much for joining me, and thank you for all that you do.
Such a pleasure to be back with you. See you soon.